Hey everybody, welcome to another ATDev Podcast. We're joined today by Dr. Sarah McCabe, a doctor of physical therapy. Thanks for being here, Sarah.
Thank you so much for having me, Owen. I appreciate it.
Of course, I know we have been working together for a couple of years now.
Yes,
Um, yeah, yes, it'd be great if you could maybe give a little intro on yourself and your background.
sure. So, like Owen said, my name is Sarah McCabe. I'm a doctor of physical therapy. I've been a physical therapist for 6 years at this point. I think I originally, Todd and I met at a Super Bowl party where we were speaking and we were just speaking about, his developments, what he was working on, and what I do. And so now we have been able to collaborate together with you. And I think you guys are making an amazing product, hopefully one of many. But a
Yep.
little bit about myself. Like I said, I've been a physical therapist for about 6 years, and I work at an outpatient orthopedic hospital or a clinic within a hospital. I have gotten a orthopedic residency. I've done an orthopedic residency, and I've also done a sport specific fellowship. So I've done some extra training in a little bit of a different world than I think you guys have introduced me to, which is so great because I think I've been able to see just how vast physical therapy is and the worlds that we can work together and collaborate in.
Yeah, yeah, absolutely. I know I've had a similar experience where, I think a lot of people think physical therapy is a pretty niche field, but that's not the case. It's actually quite expansive.
Yeah, it's very expansive. And I think as I was thinking about all the things that we do, I think the world in general doesn't have a great understanding of what physical therapists do, but I don't know if physical therapists market themselves correctly in that
Hmm,
way. Is that, yeah, I mean, there's so much that we do from preventative to rehabilitation, also just helping people fit and customize assistive devices, change people's homes and their ergonomics. So, it can go all the way from helping pediatric patients to geriatric and everything in between. So, I've certainly learned that there's many populations that physical therapy can help with as I've worked in the field for some time now.
yeah, absolutely. Was there a particular moment that you can point to when you decided to become a PT and, what inspired that decision?
I think in general, and probably like a lot of physical therapists, at least the stories that I've heard, I've always been involved in sports. And so within those sports, I've had my own set of injuries that I've had to rehab through. And I think that based on the experiences that I've had, physical therapy wasn't really an option or an offer. So it seemed that it was something that was not accessible to everybody, which at that point,
Right.
I think I wanted to make a difference in that. But I think another experience that kind of shaped this for me was growing up. My grandma, she actually had a hemorrhagic stroke when she was 38 years old. So
Oh, wow.
yeah, so I think that I've always just had an understanding that not everybody's body works the same. And living with her and just seeing the adaptations that needed to happen within our household, just because the world isn't necessarily built for people who are differently abled. So just
Yeah.
kind of having that understanding and trying to bring two separate worlds together, which was ultimately physical therapy. So my love of sports and movement and the body, and how could I bring that to people who are differently abled than other people, and just combining that. So I think having the understanding and living with my grandma and seeing the experiences that she's had along with my own experiences um, has just brought me to a place where I try to improve the functional ability of, my patients and my clients.
Yeah, absolutely. Yeah, I mean, I think that, yeah, you touched on a lot of things that really resonate with me, as a person with a disability and living in a world that isn't necessarily designed for, you know, adaptations. You have to really do a lot of that, on your own or with the help from, a PT or an OT. And I think, also, like you said, there's a there's like a mental element of it as well, of like the recovery process. It's not just a physical, doing your range of motion or stretching. You also have to have that, mental game of recovery and improvement.
Yes, that is very true. I think in my first couple of years of working as a physical therapist, I didn't have that full understanding. So I was trying to treat injuries. And over the years, I've learned that you need to treat the whole person and just meeting them where they are physically, but also mentally and emotionally, because people are coming to you presenting their vulnerabilities and their literal weaknesses of things that they can't do.
Right,
And so I think being a part of that process and understanding that my expectations for people may be different than their expectations, but as long as we're collaborating and we're doing something meaningful for that person to allow them to continue to live the life that they were living before or to live a better life or in some cases maintaining the life that they have, all of those are different aspects that need to be taken into consideration. But I think that at least something that I've learned is that you must treat a person holistically and take into consideration all of these different factors that ultimately have a it their prognosis depends on it. If you're not hitting the right
right,
things, if you're missing the mental aspect of it. So a lot of times it's not just myself and just the patient. There's other people that may need to be included on the process, even just like a psychologist or some type of mental therapist as well.
right. And I think increasingly technology plays a role in that, and that's, something that we're doing with Reflex. But I'd love to hear, what role technology plays in your practice and how has that improved what you do, and also what additional challenges does that bring?
So I think that in the outpatient world, at least when I first started practicing until now, things have looked a lot different. I think it's moving, and you guys are certainly a company and an idea that is helping to move it into this and to transition into something different. I think before outpatient technology was possibly a little bit more passive, so it was to help people decrease their pain in the moment, whether it was with ultrasound or some type of electrical stimulation. And that would help you, again, feel better in the moment. Research has shown now that some of those modalities are less effective. But I think in the outpatient world now, things are transitioning to what probably the neurophysical therapy world and the neurology world in general has been doing for quite a long time, which is using technology in conjunction with therapy and to
Right,
help improve people's function. So instead of just having someone come down and lay on a table and put them in ice and heat or with some electrical stimulation, now we're having people get their range of motion, use these assistive devices like the Reflex while they're exercising to gain those or make those gains. So I think that using technology with function is really the way of the future.
yeah, that's definitely the hope. And I have a neuromuscular condition, so I have had a lot of neuro PT and So I think my my background is on that technology side, so I can definitely relate to what you're saying there.
Yeah, and I think the most amazing thing, at least with the, and you could probably speak to this a little bit more than I could, but a lot of the devices that are being used right now have to stay within the clinic, or they're big and they're cumbersome in order to help someone move. But I think a fabulous thing of what you guys are doing is making something that's portable that people can use in their home, which is so important because a lot of people don't have
Yeah,
that access to a clinic at all times. And so for you guys to provide something that gives people an opportunity to improve upon their movement or better do their physical therapy exercises in the comfort of their own home, I think that's a huge transition. And I think it's such an important piece to all of this that has been missing for a long time.
yeah, yeah. I mean, there's just so many potential barriers to accessing physical therapy, whether it's a difficulty getting to the clinic. I think it's kind of ironic that when you're injured, you have to leave the house to go somewhere to feel better. So, if you can bring that care to the home, that's definitely a way of, improving access. But I think there's also insurance issues and things like that as well.
Yes, absolutely. I think pretty much what you said. It's ironic that people who are injured or who have a difficult time moving have to come into a clinic to get their treatment. So I think some type of remote physical therapy or remote therapy is beneficial, certainly. And I think as we had times with COVID where we had this time to experiment with these type of things, myself included, I had to become so much more creative on how to
Right,
get people to get results. But the beautiful thing about it is that I actually got to see people move and function in their own environment, which is where they spend most of their time, which is where they're going to do most of their PT or rehabilitation. So I think getting an insight to see what challenges do people have in the home, or how can we create an environment that's more successful. I think that the unfortunate time of COVID also allowed us to expand on that remote part of physical therapy, which wasn't
right.
really, I don't think it was a thing at all before.
Yeah, no, definitely not. I mean, I don't ever remember being able to have even a telehealth appointment before COVID, and now that's kind of the default option, which I think is really enabling and allows people to access care a lot better. But I think there's also potentially some downsides to it as well. And that's something that, we hope to address with Reflex, is being able to find a happy medium where you can do remote care, you know, probably not as effectively as in person, because I don't think you can ever fully emulate or replace the human hands-on touch.
I would
But
agree
I
with
think,
that.
I think that there's I think there's definitely room for improvement.
Yeah. I mean, there's certainly articles that I've read that just say that if, the human touch alone is healing and people will get better from that. I think the place where you guys are certainly helping with the reflex is during remote training or treatment, how do you measure if people are getting better? And you guys are providing specific measurements and objective goals that a therapist can monitor while the patient is at home. I think that's a huge step in the right direction of making, how do you make measurable differences? And you guys are filling in that gap, certainly.
Well, I'm glad to hear you say that. Yeah, something we always say at ATDev is, if you can measure it, you can improve upon it. One of our guiding design philosophies.
Right.
Yeah, so maybe as you look back and look forward, how have your goals as a PT evolved over the years?
I love this question because it makes me do some self reflection. certainly, which I think is important for any person or anyone working in a field with people. But I think my goals have changed in the way that I define success. So
Mm,
before, when I was a new PT, success to me meant that I helped people's pain, that I changed people's pain, which then made me responsible for people's pain and improving their pain. And I realized that sometimes pain didn't change. However, other things changed, function changed, strength changed. So then it forced me to transform my goals and to take a more individualized approach with people. So I now look at a person and instead of, hey, I'm going to go in there and change their pain, I look at a person and I say, hey, how can I help them improve their life? And what does that mean to them?
mm,
So I have to understand what my patient or what my client's expectations are. And then I know that I can improve something by possibly educating them about their condition and giving them tools that will empower themselves to either return to their previous level of function, ideally to return them to a place where possibly they're functioning better than they were before. But I
that's
think,
great.
yeah, just understanding and redefining what success means and making it meaningful to the patient. I think it was a lot more centered about I had to change people's pain versus how can I help people and meet them where they're at so that they can live a successful life. And what does success look like to them?
Yeah, that's really great. I love that holistic approach and, also patient, human-centered approach. I think that's really, really wonderful.
Yeah, I think that's why I got into this in the first place is just the connections that you form with people, especially at a time where they're their most vulnerable. I think that those connections are very important and they're very meaningful. And I try to learn from those connections and harbor those connections so that I can take those experiences and learn from them and then apply them and improve upon them for the next person.
Yeah, wonderful. Well, thank you so much, Sarah. It's really been wonderful to chat with you, and thank you for everything that you do and all the people that you help feel better.
Thank you. Thank you for having me on here today. Thank you for allowing me to be a part of this process and introducing me, like I said, to new and different things. I've certainly learned a lot working with both you and Todd, and I hope to continue doing that because it's been a lot of fun so far.
Yeah, same here. All right. Well, thanks for listening, everybody, and stay tuned for the next one.